Alright guys, I'm Dr. Kelvin and you are welcome to my channel. Now in this video, we are going to be discussing a very important tool that everybody needs in their closet. Well, actually in your bedside drawer, but you get the message. And that's a blood pressure monitor. Ideally, everyone should have one of these in there because the best time to actually check your blood pressure is early in the morning when you're just waking up before you step out of bed. And so if you have one there in the bedside drawer, it makes life all the more easier because once you step out of bed, once you start dealing with the pressures of life, it will also start going up, and that could cause errors in your blood pressure reading. So everyone needs to get one of these in their arsenal. Now the question is, which one should you get? Now from where I sit, it doesn't really matter which one you get. All of these are amazing machines that actually do their job. This one, the Omron BP710, is a smaller device, much more simpler to use. You literally just press one button and it starts the reading, gives you what you need to get. This one, the Omron M7, is a bigger device that has a bit more functions on it. If you're a sophisticated person or you like to keep a lot of data, this one is for you. Now, both of them will come with their own blood pressure cuffs. Now, there are two different kinds of cuffs that you can find with blood pressure machines. There's the stiff cuff and there's the soft cuff. Either of them is fine, but there are some limitations with each of them. This one is much easier to use because it comes in with a bit of a stiff material, which tells you that it has to encircle your arm. The placement of this one is very simple and straightforward. You open it up, make sure that the tube is always pointing towards your fingers. This tube is always pointing towards your fingers. So you open it up and then you slip it on, and that's it. It holds the arm and you're able to simply close this one with the tube pointing towards your fingers. And then you connect the tube to the machine. And that's it. You press it and it's going to check your blood pressure. But there's a limitation, which is that if your arm is big, you cannot use this stiff cuff. I repeat, if your arm is big, you cannot use this stiff cuff. If you force this cuff on an arm that is bigger, you're going to get errors in your blood pressure reading. And so you need to find a flexible cuff or a much bigger stiff cuff that can go around your arm. So depending on the size of your arm, you need to make sure that the cuff can go around your arm comfortably. That is how you use this one. Now this is the flexible cuff. It's a bit more difficult to use for a newbie, but it's also pretty straightforward. You can easily learn it. So you just make sure that, as usual, the tube is always pointed towards your fingers. You pass your hand through, and then you tie the cuff around your arm, and that's it. You're good to go. And then you make sure that you plug the tube into the machine, and then you press your button and you check your blood pressure. So that is how to use the flexible cuff. Now this flexible cuff is easier to manage if your arm is big. So I repeat, the advantage of this one is that if your arm is big, it's much easier to use. So when you're buying a blood pressure monitor, make sure that the cuff goes around your arm comfortably. Very important, because remember that this is a self-administered blood pressure monitor, and so you want to be able to do it by yourself without anybody helping you. So make sure that the cuff can go around your arm comfortably. Now, should you check your blood pressure in both arms, both your left and your right arm, every day? Not necessarily. Just pick one arm that you're comfortable with and then just check your blood pressure. So most of the time, if you are left-handed, you can check your blood pressure on your right arm. If you're right-handed, you can check your blood pressure on your left arm. So your dominant hand is what you're going to use to apply the cuff and then close it up. That's how it goes. However, if the difference between the blood pressure on your left and the blood pressure on your right is more than 10, that's a cause for concern, and you need to report your healthcare practitioner so that we can investigate and find out what is causing it. But most of the time, nothing like that comes out, so you are equally justified if you wanted to check your blood pressure in both arms. The most important thing is to grab the machine, keep it in your bedside drawer, and check your blood pressure at least once every quarter. If this information has been beneficial, subscribe to my channel and do share this with your loved ones so that we can build a community of health-minded individuals who want to enjoy good health for longer. Have a fabulous time. Peace.